According to the CDC, almost 32% of births in the United States happen through cesarean section, also known as a C-section, each year. A C-section is a type of surgery where a doctor makes an incision into a woman's abdomen and womb to deliver a baby. Out of more than 3.9 million births every year, approximately 1.4 million babies are delivered by C-section. Data from the World Health Organization indicates that cesarean section rates have increased by 14% worldwide since 1990. The operation was once considered a last resort for women and babies in mortal danger during birth, but even though the procedure is not without risks, C-sections now occur millions of times a year, and healthcare providers today consider it very safe. Some women even choose the procedure as elective surgery for reasons including a large baby, the mother having a transmissible condition like HIV or herpes, or a multiple birth pregnancy with twins or triplets. However, even if a woman chooses not to have one, emergency C-sections can be required due to problems like a breech presentation, where the baby's buttocks or feet would emerge first rather than the head. A doctor may need to perform a C-section when a woman's cervix doesn't open wide enough for labor to progress. Issues with the umbilical cord getting pinched or an abnormal heart rate also may indicate the need for an emergency C-section. During a C-section, the surgeon separates a woman's abdominal muscles to gain access to her uterus. The doctor makes a horizontal incision or vertical cut in the wall of the uterus and then delivers the baby through the incision. After successful delivery, the uterine incision is closed with stitches that later dissolve in the woman's body. Then, the abdominal skin is closed with staples or stitches. Incredibly, a C-section only takes about 20 minutes once the surgeon makes the first incision. A C-section isn't without risks, however, even when it's needed to save the life of a fetus or the pregnant mother. As with any surgical procedure, a C-section may cause an infection at the wound site, causing symptoms like redness, pain, swelling, and unexplained discharge at the incision. An infection may also occur inside the body during postpartum recovery. An infection of the womb may cause symptoms like fever, pain in the stomach area, vaginal bleeding, and discharge. Significant blood loss may occur in rare circumstances, which could require the woman to undergo a blood transfusion. Another risk is the formation of a blood clot in the leg or deep vein thrombosis. This condition may cause pain and swelling, which could become life-threatening if the clot travels to the lungs and causes a pulmonary embolism. In rare cases, a woman may experience damage to organs close to the uterus, such as damage to the tubes that connect the kidneys to the bladder, or even damage to the bladder itself. This would require the woman to undergo further surgery. According to the UK's National Health Service, some risks also exist for future pregnancies. A woman who becomes pregnant again after having a C-section has an increased risk for stillbirth, and previous C-section scars on the womb could open up during pregnancy. Some women experience a complication where the placenta attaches abnormally to the wall of the womb, which could make it difficult to deliver the placenta in future pregnancies. A uterine rupture may also occur in a future pregnancy in some women who opt for vaginal delivery. Although a C-section may save a baby's life, there can still be risks for the fetus, like a cut to the baby's skin, which could happen accidentally when the surgeon makes an incision in the uterine wall. Fortunately, these cuts are usually not severe and quickly heal without complications. A baby may also experience breathing problems that will require close monitoring of the vital signs for a few days, especially for babies delivered before their due date or before 39 weeks of pregnancy. Anytime surgical incisions are involved, there is an understandable concern about pain. A woman who has a C-section shouldn't feel any pain during the procedure due to anesthesia. However, some women report feeling pressure or pulling during the procedure when they undergo regional anesthesia. A woman may experience pain at the incision site for several weeks after the surgery, and it's possible she may experience urinary incontinence, because of a weakening of her pelvic floor muscles. Some women may have problems with constipation or experience difficulties breastfeeding after a C-section, and it's important for them to ask for help if they are experiencing troubling symptoms. Ultimately, recovering from a C-section means getting enough rest, managing pain with over-the-counter medications, and immediately contacting the doctor if pain doesn't subside or an infection is suspected. The more you know about C-sections, the better prepared you can be. Keep in mind that you're not alone. You can learn more about causes, treatments, family forums, parent support groups, and more at birthinjurycenter.org. The Birth Injury Center is here to assist you, offering consultations and abundant resources available to help you learn more. For your own peace of mind, please visit birthinjurycenter.org.